Hello and welcome to another episode of KARE 11 on the Record. I'm political reporter Danny Spiewak. This week we sit down with GOP governor hopeful Kendall Qualls, who 4 years ago sought his party's endorsement, nearly won it, but is trying again and seeking the nomination here in 2026. We also sit down with DFL State Senator Elise Mann, a physician who has spoken out recently against ICE being in hospitals and healthcare settings. But we begin with Qualls, who we did ask about the ongoing crisis with ICE.
So I'll just get right to it. I want to start with the crisis that Minnesota is in. To put you on the spot, if you were governor right now, how would you be handling the crisis that Minnesota faces?
Yeah, this is a crisis, and it's unfortunate because we're the only state going through this mess. Not Michigan, not Illinois, not any other Democrat state are having shootings and killings. It's tragic. So I can tell you, I can be confident to say this. If I was governor today, we wouldn't be mourning those two deaths. I would be working with and coordinating with federal agents like we normally do, like every state, even Illinois and Michigan, are normally doing, coordinating with federal officials to ensure the safety of our citizens here in Minnesota, to really go after really the criminals, the illegal immigrants that are here unlawfully, and protecting our citizens. That's number one. Those deaths most likely, I can be assured, would not have happened.
From the Trump administration's perspective, have you been supportive of the way they've carried this out? Do you place any blame on what they've done in their operations in the state?
Well, let's just take a look at this first. I'd like to put this in context for everyone to take a look at this. Candidate Joe Biden in 2020 did not run on or campaign on bringing in 15 to 20 million illegal immigrants into the country in 38 months. He did it. He didn't run on it. President Trump ran on removing those 15 to 20 million illegal immigrants. This is not an ICE problem. It's really, unfortunately, not even a Minnesota. It is a Joe Biden problem that President Trump is cleaning up. Now, the problem is that what we're going to have is not in any operation that you do, you're not going to have 100%, execution on it. There's been some missteps. And look, the worst thing to do is to be held in custody, arrested, having done nothing wrong at all, especially you're arrested or detained because of your skin color. It's dehumanizing. It just robs you of dignity. But those things I would make sure wouldn't happen because the coordination and accuracy, and it's my job would be to make sure that those things are minimized to its fullest extent and not happen at all. It is the actual goal we should have. So I can tell you that from that perspective, not working with and coordinating with federal agencies increases those errors and mistakes. By coordinating with them, we minimize them and actually, hopefully, eliminate them.
What specifically would coordination look like? I know the state DOC has issued scathing statements against the administration, saying that they are coordinating. What would that look like in your mind?
Look, this is pretty honest. I just look at the public statement from the police superintendent of Chicago, the blue state of Illinois, the blue city of Chicago, that he said we coordinate with federal agents to crowd control, to ensure that the perimeters are secure, that civilians do not get in to interfere with federal agents. I'm using his statements. And he basically said that we are not going to be doing these things of allowing protesters to get involved with federal agents. He said actually he was informing his community that it's a crime to interfere with federal agents. And he, again, the Chicago police chief said that shooting to Renee Good was a lawful one by that federal agent. And again, I'm just using what was standard protocol in law enforcement agencies around the country that has been standard for years.
When it comes to, though, just the support of the operation, are you broadly supportive of what the administration's doing in Minnesota?
Well, again, President Trump ran on that issue. He got elected, not just electoral college, on the popular vote on removing the illegal immigrants from this country. And yes, look, there are over 40 countries came into this country, 15 million people within 38 months. There's no precedent for it. And, to be quite honest with you, Dan, when I take a look at this, when all that was going on, I didn't see a lot of media attention toward it. I didn't see protests in the streets about this. 15 million people is equivalent to the everyone in the state of Minnesota, Illinois, and Wisconsin combined in 38 months. That has never happened in the history of our country. And we know that there are people on the terrorist watch list on that list, obviously criminals and violent criminals around this all together. So here's what I can share with you. There are three people that were arrested by ICE here in Minnesota. Coincidentally, they all three were Somalian illegal immigrants, criminals. One vice lord, gang member, violent members, domestic abuse, one DUI. Look, my family and I were in a car accident from an illegal immigrant that should not have been here. My wife suffered 2 weeks of hospitalization. I was in the hospital for 2 weeks. My daughter, 2 years old, 3 days in a coma. So this is not benign. Oh, we're just going to come in here and let them have a good opportunity. That's not how it works. And we're doing injustice to people that have been brought here, came here legally. I have neighbors from India, from Pakistan, from Nigeria. It took them 8 to 10 years to get citizenship, and they had to waive any public assistance. And what's happening right here, they're insulted by how this has all happened in the last 4 years.
Looking ahead to the campaign, you've got the precinct caucuses starting, you've got the convention coming up. What positions you in your mind to be able to win an endorsement from your party?
Well, it takes a lot of work to win the endorsement, but more than anything, it is winning hearts and souls of just regular, everyday Minnesotans that are really tired of taking a look at how expensive it has become to live and work here in Minnesota. Over the course of the last 8 to 10 years, actually household income has declined. We're ranked number 46th in the state of 50 states of income growth. Our taxes have gone up to one of the highest. This year, average property taxes have gone up 8.1% across the state. It has become unsustainable, and they're responding to my message of an outsider from St. Paul to help clean up St. Paul. That's number one. Clean up the fraud, clean up the mess. The taxes are out of control. But how do we get back to making sure that the state thrives economically, becomes the engine that it used to be, that people can prosper here, stay here, raise their families here? We're seeing people flee to just the neighboring states. And they want the crime settled. Minneapolis used to be the number one safest city in the country, according to Forbes magazine in October 2009. It's far from that today. It's a shallow of itself. And we want to get that back. We can't be a great state without a great Minneapolis. And then lastly, public schools used to be a marquee of the country. We were top 5, top 10 at worst. Today, literally, we're down to 39th. I mean, literally, when you take a look at our reading scores, where we are with fourth graders, math scores, we're wallowing in the bottom middle nationally. This is an embarrassment. We can do better because we are better.
Republicans in Minnesota have typically abided by the party endorsement rather than a primary through voters. If you don't win the endorsement, will you be bound to that decision? Would you run in a primary?
Well, there's a predicate for that. Again, people knew I ran last time. I barely missed the Republican endorsement behind Scott Jensen. Narrow victory for him, and I abided by the endorsement. I went on the Capitol steps and endorsed Scott Jensen. We raised our hands together, and I walked down their steps lonely by myself, humbling, very humble experience. But you know what? What's more important than my personal ego, my personal ambitions, is that the party's united so we can win together as a state.
You don't need me to tell you a Republican hasn't won statewide in Minnesota in 2 decades. So what would make you any different if you were nominated?
Well, that's a great advertisement for me. We haven't won one because we hadn't had a great candidate like myself. No, I'm kidding. I am a great candidate, but I'm a different candidate. Different candidate. When I say different, not just my skin color. I'm different because the story of America works for everyone regardless of race, regardless of social standing. I come from nothing. Came from nothing. I'm a divorced family, lived part of my childhood in Harlem, New York, in the worst of times, in the late 60s, early 70s. I lived there with my mom and 4 siblings from 1st grade to 5th grade in the epicenter of drugs, violence, with the worst things you can ever imagine. Then I moved with my dad after fifth grade. I was 11 years old. I moved to a trailer park in Oklahoma, and I lived with him for the rest of that time, but visiting my mother every summer. So I got a chance to see up close and personal what poverty's like, crime, and living in that environment. But I got enough of an education to be competitive in the free market, capitalism. Got enough. The kids today in our state are not getting what I've got growing up. That's something that bothers me in a great deal, because everyone deserves an opportunity, an open door, and it starts with an education. And so I worked full-time, paid my way through college, served in the Army Reserves while I was in school, and then went on active duty after 5 years. And after that, I went into the private sector, the first in my family to go in the business world, leading sales and marketing teams from first-line manager to director to vice president, and global businesses, leading sales and marketing global business units. And I've had a very fortunate career. My wife and I raised 5 kids together, be married 40 years this year. And that story can be replicated by anyone, regardless of race. And normally it has been. Unfortunately, that used to be the norm, especially for the Democrat Party. They don't even advocate for that anymore.
On the flip side, a voter may look and say, you haven't held elected office. Why should they trust you to run what would be a $60 billion plus budget at the state level?
Well, that's actually a plus, to be honest with you. When they say you haven't run for, thank goodness. Because you take a look at some of the, especially swing states, Virginia, Michigan. These purple states, when they went with someone outside the Democrat Party, they went to a Republican that was outside of politics. They went to business guys, okay? If you remember Scott Youngkin in Virginia, in Michigan, before Gretchen Whitmer, it was, I think his name is Rick Scott. Rick Snyder. And so, my business background, leading businesses, managing a bottom line, a P&L responsibility, serving in the Army in leadership, having traveled the world in my responsibilities in the military as well as in the civilian sector and private business. I understand the global markets, especially as it relates to our agribusiness. And a lot of that, we need to take a look at markets where we can grow business and actually perform and have businesses thrive here in our state. But at the end of the day, it's about responsibility, accountability, and leading teams from diverse backgrounds. That's what we do normally every single day in the private sector. Politics is not something special. We've overcomplicated what it's like for businesses. In fact, if the criteria was experience in government, well, Tim Walz have had a lot of experience, 20 years of it. Even Amy Klobuchar has had over 20 years. She signed off on remember the Affordable Care Act? We have to have this to lower health care, and we can have great health care for everybody. Today, Obamacare needs subsidies for it to work. The solution is not more government, it's actually less, and getting leadership outside of government to help us get back to normal.
Do you still believe the Affordable Care Act should be repealed?
I believe we should have a health plan and options that's affordable, period. And we're going to find those solutions. We're going to find those solutions because it's not happening today with Obamacare.
If you were governor in 2027, you would immediately start out with a potential budget deficit of somewhere around $3 billion. How would you handle that as a governor?
We would do the responsible things and making sure that our budget would align to what our expenses are. People do this every day in their home budgets, their personal business, small business, and large businesses. This is not an anomaly, but anywhere but in government. And we need to bring some practical common sense back into our government and leaders that understand how to get it done.
I know in the campaign trail that you and many of the other Republican candidates have been very vocal about fraud and as it relates to Minnesota state government. What would you do differently than the current administration? What would you implement as anti-fraud measures that haven't been put in place already?
Well, the best anti-fraud measure is leadership. Okay? Listen, I can just tell you this. Look, fraud happens in the private sector, but it doesn't happen for 10 years. Number one, after each quarter, we do financial roll-ups to find out basically our expenses, our revenue, where are we spending that money. And if there's an anomaly, we'll know that first quarter or even at the worst, that second quarter. and there's embezzlement charges, there's people held accountable. That happens all the time in business. Here in Minnesota state government, there's not been one person fired. Tim Walz has not fired anyone in his administration for what has happened and this total mismanagement, total misstep and oversight. So if you talk about, well, he hadn't had experience in government, thank God. Okay, no, I haven't had experience in defrauding $9 billion and not holding anyone accountable for what's happened. There are people that have been involved in this fraud that are living a better lifestyle than the Minnesotans that are paying their average taxes and living and paying those subsidies, paying for that lifestyle that they have been taken out and defrauded, and that money's been taken out of their own pockets for it.
Would you retain the fraud czar that the governor appointed a couple of months ago?
We'll start all over. It's about leadership. And just being transparent. And one of the things we would do, look like publishing, probably look at doing it quarterly, at least semi-annually, where we would actually show these are the expenses. This is the budget. These are expenses. Where are we in relation to our annual budget and our spend? So people in Minnesota know where the money's going and for what it's going to.
My last question, an issue that was a major part of the 2022 campaign after the overturning of Roe v. Wade with Dr. Jensen, the issue of abortion rights. Can you clarify for voters where you stand as a governor on that?
Well, first of all, let's just look at that. That is not even on the list of the top 10 issues for Minnesotans, for abortion. It's been codified into state law. Okay, so there's not an issue by the Republican Party, any of the candidates, and myself included, that we're going to address that state law. Me personally, I can tell you, yes, I'm a Christian, and I believe in I'm a pro-life person. That's how I live my life, my entire life, regardless of what's on the ballot. Regardless, we have 5 children. We adopted one of them. I can't remember which one. I love them all the same. Okay, that's how we do that. But I don't force my personal views down your throat or anyone else's throats. The abortion issue is not an issue for on this ticket, on this election cycle. I know the Democrats probably would want to make it, but it's been codified in the law.
All right, Kendall, thank you. Appreciate you taking some time.
Yeah, absolutely. Glad to be here.
Welcome back. DFL State Senator Elise Mann is a physician who held a press conference in January alongside other lawmakers and medical professionals speaking out against ICE presence in hospitals and healthcare settings across Minnesota. She was also the main author of the Paid Family Leave program that just launched here in the new year. Here's what we talked about with Senator Mann this week.
Well, Senator, thank you for joining us today. We appreciate it.
Thank you. Thanks for having me.
I was at the press conference that you attended a couple of weeks ago with the medical community talking about the presence of ICE in healthcare settings. What have you heard about agents being in hospitals and healthcare settings?
Yeah, so we're hearing from really hospitals across the state that ICE agents are walking into the hospitals, walking into the clinics, roaming the hallways, entering patient rooms without identifying themselves, without search warrants, and asking people what are they doing there, where they're from, while they're laying in a hospital bed. We've heard stories about ICE agents being inside patient rooms and refusing to leave when the doctor has to do a physical examination, when the nurse has to clean the patient. So we're hearing really awful, atrocious stories about violating people's most basic privacies. And then when they call the police, the hospital administration, hospital security, still refusing to leave. And so it's been a really big problem.
When the session starts up again in February, obviously, how are Democrats planning to respond to the ICE situation right now?
Well, we have a slate of bills that people are working on to, unmask the agents, to tighten or to really secure our constitutional rights. And so it's certainly something on the forefront of everybody's mind, not only in the legislature, but in the street. Life as we know it has completely changed in the last month because of ICE presence. People aren't going to school. People aren't going to work. Restaurants are shutting down. We are hearing that ERs have a 20% decrease in patient population showing up because people are afraid to go to the hospital. We're hearing classrooms where 60% of students are missing. So this is something everybody's thinking about.
There have been some Republicans, even in the legislature, who have voiced some concerns here in the last maybe week or so. What have your conversations been like across the aisle? Have you spoken to any of them about how they may or may not join you on some of these efforts?
Well, we had a hearing yesterday where my Republican colleague said that this is about criminals and ICE is here to remove dangerous criminals. And that is, for the ones I've spoken to, the story that they're sticking with. Despite us knowing full well that that is not the case. This is not about criminals. This is about ICE agents going door to door looking for Black and brown people, taking them out of their homes, lawful residents, American citizens, taking them out of their cars after bashing in their car windows, abducting children off of the street with no jackets, with no parents. So tell me, the question I always ask is, little Liam, who was 5, who was abducted, what crime did he commit? We had a brother and sister, 15, 16-year-old from the suburbs, abducted in the last 3 days. What was their crime? 4 students now from Columbia Heights abducted. I mean, this is so far beyond criminal activity that we're not even on the same planet when we talk about it anymore. But that's what we heard yesterday at the committee hearing, is that this is about criminals, and that is the story that they're sticking to.
When it comes to some of those arguments, what do you make of what you often hear from the administration or from Republicans in Minnesota that more coordination, especially with county jails, could help the situation? What do you make of that argument that's often made? Well,
we are coordinating with the federal agencies as outlined in our laws. We are doing those things. We had a story from, I can't remember which county it was, that they had someone holding them in jail, and when their time is up, we let them go when we let ICE know. And ICE was called, and ICE said, we're too busy in the cities to come get this person. And then they turn around and say the counties are not cooperating with them. So it's a false narrative that we are not cooperating with what we have to do to follow our laws.
Switching gears to another important issue, obviously paid family and medical leave just launched, and you were the top author in the Senate of that. How would you assess how it's going here in the first month or so?
It's going so good. I'm so excited about it. People are getting the time they need to take care of their families, take care of themselves, to be with their newborn babies. It's incredible. Someone just texted me probably 2 days ago and said, I had a baby 3 years ago. It was really, really hard. We had to take unpaid leave. It put us really a big financial strain on our family. And we just had our second baby 2 weeks ago. And this time around, it's so much easier. And thank you. And obviously that just made my day, because that's the point, right? To make sure that we all understand that we are all human beings. We need time to be with our families, to be with our loved ones, take care of new babies, and to be able to participate in a program that is doing that and giving that to people has been really, really special. We talk to DEED regularly about how it's going, and the rollout has been fantastic. Again, people are getting their paychecks. The turnaround time for claims is less than 2 weeks. So the program is going really, really smoothly, and I could not be happier.
What's your dialogue been like, ongoing dialogue with, say, the Chamber of Commerce or other business groups that had concerns? They had thought it was what they called a one-size-fit-all. Have they pushed for any changes in the legislature? What have you talked about with them?
There was push over the last 2 years to essentially almost dismantle the program. Since its rollout, I haven't heard anything. No one's come to me with anything.
You announced you won't be seeking another term past 2026. Just tell us a little bit about the decision to step aside after this term.
Yeah, well, serving in public office is hard. It takes a toll on your personal life. It takes a toll on your family. And I am a physician. I've wanted to be a physician since I was 12 years old. That's all I ever wanted to do. The reason I became involved in politics is because I saw how politics was completely intertwined with medicine. And it was difficult to stand up for your patients and to be a good patient advocate without also being involved in politics to change the policies that led to poor patient outcomes. And so, I had the one thing I can point to was inhalers. Inhalers are notoriously expensive. And I had the family that I saw in the clinic one day. The little 8-year-old boy needed his inhaler. I prescribed it. And then I saw that same family in the emergency room few days later because he couldn't get his inhaler. So now we're paying for an ER visit. We're paying for acute treatment in the ER, which is significantly more expensive. And I got so mad that I ran for office. Now I'm going back to medicine is basically what that boils down to. I served a term in the House. I served a term in the Senate. But I want to get back to what I love, and that's taking care of patients in the hospital.
I know 2026 isn't a budget year, but of course, when it comes to health and human services, that's often one of the areas when you look at the budget and the potential deficit down the road that may need to be some costs looked at. How do you think the legislature should attack that here in not just this year, but moving forward?
Well, we have a lot to consider this year. The federal government is cutting our funding left and right across all sectors, housing, food assistance, healthcare. And so we are going to have to really sit down and prioritize what we're going to have to fill. The state cannot fill the holes that the government is going to put in our budget, that the federal government is going to put in our budget. We just can't. And so we really are going to have to work together as a team to figure out where the biggest holes are going to be and what we can do to fill them.
Obviously, the legislature as a whole has just been through so much, especially since June. What has it been like in talking to colleagues? What do you think it'll be like to return to session in February?
It's been really hard to have, your friends and your colleagues threatened, and certainly your friends murdered. So it's been very hard. I think that coming back into session will be difficult in that, everyone's a little weary about our safety, given the increased political violence that we're seeing. Flames stoked by, again, the federal government, who calls Democrats radicals and thugs and all sorts of other things. But I think it will also be healing for us all to be together, again, putting our heads down and working for the people of Minnesota, which is all the reason why we're there.
Are there any other priority bills that you're looking at here for your final session?
I spent a lot of time in the healthcare space. I have a lot of bills to continue to try to decrease the cost of healthcare and increase accessibility. So, working with insurance companies to see to alter some of their practices, if you will, so that patients can get the care that they need when they need it without someone who's never met them, who's never laid eyes on them, to dictate what care they do and do not get.
Thanks for joining us for another episode of KARE 11 On the Record. We'll see you next week. And remember, you can stream every Sunday at 8 a.m. on KARE 11 Plus and watch these episodes on demand on our YouTube page.